Ronald McDonald comes up as a classic example of a cloud that many people find.
I'm with you. Ronald McDonald is a little creepy. Welcome once again to Free Associations from the Boston University School of Public Health, the Public Health and Medical Journal Club podcast for anyone as confused by the latest health study as I am by the weather. I know it is cliche to talk about the weather, but I feel like we have to talk about the weather. It has rained every weekend for the past, 50 years, it feels like?
Correct.
How are we supposed to exist in the place? And we also went from 80 degrees on Saturday to 30 degrees today. What is happening? And not to mention the fact that there is no heat in this building.
That's what I thought you were going to say. I'm sitting here in a down jacket and gloves.
So Jess is wearing gloves inside the office, if you can believe it. So we are clearly in unusual times.
The temperature's been all over the place. It was almost 80 last week, and now we're in the 30s.
And is it the universe trying to tell us something that it switched from 80 to 30 just before Halloween, so the kids had to go out in cold jackets and all that?
I think that could very well be the case.
The universe is angry.
Did you have a lot of trick-or-treaters?
No,
this year?
And
No.
I have to say I bought more candy than usual because I always fear that we're going to run out. And I didn't even give away half of the candy, so now I have to eat it.
You know, we bought bad candy this year.
Intentionally, so that you couldn't eat it? So that you wouldn't eat it?
No, actually, and it was, my husband got this, it was like the Tootsie Roll pack.
Oh, no.
Where it was
you were
all
at that
the really
house?
chewy Tootsie Roll. It was like the Tootsie Roll product. So Tootsie, what are they called? Tootsie Pops, like the lollipops.
Yeah.
And then one of my daughters has braces and she's like, I can't eat any of this. And I was like, sorry.
Okay, you might as well have gotten them Necco wafers.
Right.
I mean,
we just flat out peanuts and tell the kids who are allergic too bad. Right? I know, raisins. It wasn't the best year in my house. So.
Well, anyway, I am Matt Fox from the Departments of Epidemiology and Global Health at the Boston University School of Public Health, and I am joined once again by Dr. Jessica Liebler from the Department of Environmental Health. Welcome back, Jess.
Thanks, Matt.
And we have the newest member of the Free Associations family joining us today, Dr. Allegra Gordon from the Department of Community Health Sciences at BU School of Public Health. Welcome, Allegra.
Thanth, Matt.
Glad
Jessica.
to have you here.
Happy to have you.
Very happy to be here.
And as a reminder, head on over to the Population Health Exchange website at pophealthex.org. I stopped saying the www because I was told not to. That's BU's hub for lifelong learning, where you can find archives of our previous episodes, which I know people are digging into and going into every single back episode, but also lots of population health programs and tools. And also a reminder to go and rate us on Apple Podcasts or any other major podcast apps or websites or whatever it is to help other people find us. So now on to the show. So today in our first segment, which is our Journal Club segment, we are going to look at a study on the effect of red meat warning labels. Then in the second part of our podcast, which is our deep dive, we'll talk about countering disinformation. And then in our third segment, which is the amazing amusing, we'll get into some things that make us laugh out loud or we just found fascinating. So let's get into segment one. So the article we're looking at this week looked at taxes and red meat warning labels. It looked at more than that, but it was published in PLOS Medicine, which I just want to say up front, I believe has the worst table formatting of any journal, major journal anyway. Fantastic journal. I just wish they would format their tables nicer.
I hope they're listening.
What's that?
I hope they're listening.
I assume they are.
Taking this feedback.
I assume that is why they are.
Did you also notice they duplicated a paragraph in this?
Yes.
In this paper.
Okay, somehow I managed to miss that, so that doesn't speak well.
I don't know. Editing
of
is
my
a little,
close reading.
little light on this one, maybe.
Okay, we'll have to come back to that. The study was in PLOS Medicine. It was entitled "Impact of Taxes and Warning Labels," so it wasn't just taxes, which I said before, on red meat purchases among U.S. consumers, a randomized controlled trial by first author Lindsay Smith-Talley of the Carolina Population Center at the University of North Carolina down in sunny Chapel Hill, North Carolina. I have no headlines on this one, so this wasn't one that got a lot of press, but Jess, can you walk us through this study?
I can, and I'm excited to do so. This study, to me, got a lot of points for fun. It's got a lot of fun points.
I thought so too.
Right?
I thought so too.
Yeah, so we'll discuss. Anyway, so this study, as we all know, kind of takes place in the context of a growing knowledge that red meat consumption is bad for human health and also for the environment. It's a major contributor to global warming through greenhouse gas emissions, land use, and biodiversity loss in terms of land use for red meat production. And red meat consumption is a major risk factor for cardiovascular disease, metabolic diseases like type 2 diabetes and colorectal cancer. So kind of bad all around as in the framing of this study. They don't talk about nutritional elements related to meat consumption, especially for food insecure people. But so we're putting that to the side, focused on the negatives of red meat consumption for human health and also for the environment. The authors note that the majority of Americans indicate concern for climate change and also for the negative health impacts of red meat, according to national surveys. And they reflect on the fact that public policies are effective tools in our public health toolbox for affecting behavior change around things that are health negatives and also environmental negatives. So taxes and warning labels are two of the established tools to impart behavior change. And some examples are the soda tax that exists in some U.S. cities where sweetened beverages have an additional tax on them, or warning labels on cigarettes that exist in combination with taxes, for example. So the research question that the authors ask here, their primary question, is would taxes and warning labels on red meat food products, both separately and in combination, reduce red meat purchases in the United States? So what they did, which was kind of cool, they conducted a randomized controlled trial using online recruitment and 4 experimental conditions that I'll talk about in a moment. They used, it looks like they had developed this already for other studies, what they were calling, and I quote, a naturalistic online grocery store. So this was an online grocery store platform that seems to have been designed for these kind of purchasing studies to mimic an online grocery shopping experience. The store, quote unquote, included over 13,000 products, including all major departments and supermarket aisles. It had a shopping cart, it had shopping lists, and so they were really trying to mimic a real online supermarket. Participants for this study were recruited by a research recruiting firm during a 10-day period in October 2021, using convenience sampling design, but with outreach attempting to reach a sample that was representative of the U.S. population in terms of gender, race and ethnicity, income, and age. And we can talk about their eventual sample when we discuss. Their eligibility criteria were 18 years and older, currently residing in the United States, and participants who reported eating red meat at least once a week during the last 30 days, and also individuals who were typically doing at least half of the food shopping for their households, and these folks were eligible to participate. With these eligibility criteria, they enrolled 4,148 participants during this week in October, and they randomized these individuals to one of 4 conditions in a 1-to-1-to-1 ratio. The first was a group where the red meat items had warning labels on them, and the warning label had a dual warning about colon and rectal cancer that said, warning in capital letters, eating red meat increases your risk of colon and rectal cancer. And it had a second label that said, warning in capital letters, eating red meat harms the environment. So that was their first experimental condition, where participants saw red meat products that had these warning labels. The second group, and this first group had about 887 people. The second group was a tax group, where the red meat products in this online grocery store were taxed at 30%. There were 891 people in this group. There were 866 people who saw the warnings and also experienced the tax. And then there were 887 people who experienced neither the labels nor the tax as the control group. The participants were given a shopping list with 9 items that they had to purchase, for which there were options of meat or vegetarian choices. So some of the examples for instance, had multiple meats, like they were asked to shop for sandwich fillings that could be turkey, ham, or peanut butter, a vegetarian option, or a taco filling where chicken, steak, or beans could be the option. So they had 9 different items they had to purchase, for which there were options between meat and vegetarian food choices. They had $40 to spend. The participants had $40 to spend. And then they had kind of an incentive structure where a certain percentage of participants actually got $40 at the end as an incentive. The authors had two primary outcomes here. The first was the count of products in their final shopping cart that contained meat. And the second was the percent of products in their shopping cart that contained red meat. Their secondary outcomes were the nutritional composition of their shopping basket. They viewed that through calories, total saturated fat, and sodium levels. They also conducted more exploratory analyses around the perceptions of tax and warning labels, some psychological outcomes in terms of how much did they think about the environment or the health harms or the prices as they performed the shopping task, perceptions around eating red meat, perceptions of specific red meat products, and the participants were also asked basic demographic information, including income, educational attainment, gender, and race and ethnicity. From a statistical standpoint, they used a combination of comparison tests and regression models to analyze their data alongside these endpoints. So, what did they find? Compared to the control group, participants in all three of the intervention groups, which were the warning labels, the taxes, and the warning labels plus the taxes, they all purchased less red meat according to their two different outcomes, so count and also percent. In the control group, 39% of their products contained red meat. In the warning label group, it was 36%. In the tax group, it was 34%. And the combined warning label and tax group was 31%. And each of these three intervention groups, their percentage was statistically significant than the control group. They had fewer products in their cart that contained red meat, ranging from 2.7 items on average in the label plus warning group to 3.5 items on average in the control group. So according to both of their endpoints, count and percent of products, the intervention schemes did show a reduction in meat purchasing compared to a no intervention scheme. And this reflected a 21 to 26% reduction of red meat purchases based on the experimental condition. In some of their secondary analyses, they noted some interesting things. One that might have jumped out to us as we were reading. People with graduate degrees were particularly unaffected by the combined condition compared to other people in their study. So even the tax and the warning label did not change their purchasing decisions. Younger people were more likely to be affected by the experimental conditions compared to older people and to change their purchasing in that way as well. The combined tax and warning condition led to fewer calories purchased and to lower saturated fat composition of the shopping cart, but seemingly had no effect on sodium content. Interestingly, policy support, when the participants were asked if they support these different interventions, it was low for taxes, with only 21% of respondents supporting taxes, while approximately 40% supported the warning labels. The authors noted a number of times that one of their concerns or the limitations of their study was that the participants did not exactly mirror the U.S. population. They were majority women, majority white, non-Hispanic, and their findings also might have been biased by the fact that a minority of the U.S. population, maybe 30 to 40%, actually report doing online shopping. So their experimental condition may have been a little bit artificial in that way.
Really good summary. There's so much going on here. Allegra, what's your take on this study?
Yeah. I will say I really enjoyed reading this study.
As did I.
Yeah, this is different than sort of the field that I work in, but it feels very pragmatic. And I really appreciated the very elegant design, the use of this naturalistic grocery store, which I think was called Lola's Grocery. I really enjoyed that detail. They gave us some good, rich details. So I liked that elegant design and the policy-focused approach. And that also, I was thinking about it as sort of, they have sort of a pragmatic optimism, the authors do, in undertaking this study during this very politically fractious time that we're in, but also a time when many people are very concerned about climate change, or very concerned certainly about health. And they raise the question of whether, and we can get to this, sort of the political feasibility, but I appreciate that they're building the evidence so that we can have these conversations and think about, maybe there will be an opportunity for advocacy. So just thinking big picture, I really appreciated both sort of the overall design and then what they're helping us talk about, what they're contributing to the sort of public conversation. And I like that these policy approaches are a bit like harm reduction, right? So thinking about how do policies help us adjust our behaviors to reduce the harm that we're engaging in, but without demanding purism, which I am not into, not demanding abstinence. And I think in public health, we often really benefit by remembering the principles of harm reduction and thinking about how that applies to our lives. So those are my big takeaways. I do have I'm happy to get into the nitty gritty, but I have a very basic question. As a former vegetarian, I still don't eat a ton of meat. I don't identify as vegetarian, but they don't define red meat. And so I just wanted, for starters, I would love to just briefly operationalize red meat here, because in the sandwich fillings, they list ham. Is ham red meat?
Ham is red meat.
I had that same question because do you remember, though, the pork ad campaign?
The
other white meat. Correct.
And I read that and I was like, I had the same question.
So how would you define red meat?
Well, I was asking my partner this, who is a meat appreciator, and she said, it's the meat that's red. And I said, okay, can you tell me more? And she said cow and buffalo and maybe even venison might be considered red meat. But
not pig, but not.
So pork is red meat.
You think
pork is red meat.
I was a child of the 80s. So I believed that pork was the other white meat.
I did too until I went and looked it up. Red meat just is meat from mammals. So it's any mammal.
You are
at least that's my understanding.
My mind.
I should say I said that very authoritatively. That is my understanding. Is red meat is meat from a mammal. So chicken obviously does. Birds don't count.
Okay.
And then I guess anything from the fish and amphibians would not count, but anything that is a mammal would be considered red meat, and therefore pork definitely would fit into the. But I shouldn't say that so authoritatively. That's my understanding.
It is interesting because that was clearly the understanding here that pork was considered red meat. But I had the same question because they give the alternative of pork, turkey, or peanut butter as kind of the two red meat or one vegetarian.
I didn't even pick up on that.
So that's very clarifying.
Yeah.
And I've just learned something.
Well, let's
Thank
hope
you.
that I'm right. Somebody else look it up while I'm
the pork board
talking.
Can write us.
Really.
Let us know.
Jess, what about you? What was your take on this one?
I agree with Allegra. This was a really fun study to read. I wanted to go try this naturalistic shopping experiment. It looked like it probably was pretty fun for the participants. I think my main question was whether or not this really was a realistic depiction of what people would buy, given that it very much felt like a fun exercise. But did this really reflect what people would actually do if they had, say, if they were doing a week's worth of shopping for their family, or it was highly specified who they were shopping for? Yeah, so I had some questions about the realisticness of the exercise and whether it really reflected what people would do in the actual supermarket in the context of more money. For example, if they were spending more than $40.
There's an interesting data point that they share that partially speaks to that, where they asked people what their red meat purchasing intentions were after participating in the study, and they were unchanged. So it's almost like perhaps folks were aware. Perhaps maybe they weren't aware of the sort of goals of the study, but even though behavior was affected, people's intentions were not changed by the process.
Yeah, so I thought a lot about this. Yeah. So I should say up front, I really like this study. I have a lot of things to say about it that will sound critical, but they're not critical of the design. They're not critical of the interpretation. I mean, I think there's a part of me that is, when I read studies like this, is so jealous that I don't work in a field where, I'm not suggesting this is like easy to do, but compared to like setting up longitudinal cohort studies and following people for medical interventions, this seems to me like fairly easy. It's cross-sectional in nature, only in the sense that like you only have to do it once to get a real sense for what's happening. You got to set up this online store, so that's expensive. But the ethics, right? There's not a lot of ethical issues with doing this. Like, it's just stuff that I get jealous when I hear. All my questions around this are: how much are we actually estimating the effect of the intervention? And how much are we estimating the effect of being in a study where you don't know, as you say, Allegra, you don't know what the goal of the study is, but you're in a study, and so therefore your behaviors may be on high alert. Now, you've got an intervention and a comparison arm, so you can expect that is going to even out across arms, but it may be that everybody is just on their best behavior, right? I mean, I don't, when people are, surveying me, I don't about what I've eaten, I don't necessarily tell them about the 10 cookies I ate. And I maybe say I ate, 4 cookies. So like if I know I'm being watched, what I purchase may be different. And therefore the overall benefit may be either minimized or exaggerated. I don't know which. So I wonder about things like that. And then I also wonder, okay, I thought it was clever to do the online store in the sense that if they do these, like I feel like we read a study once where it was, they have like an in-person, sort of fake shopping place. We maybe didn't review one, but I remember reading one. And I think like in those environments, you are going to be hyper aware of what's going on because you're in what looks like a grocery store, but you also know you're being watched. And so, it may change. Whereas online, like, I don't know, I'm in my home, I might feel a little bit more inclined to behave the way I normally would. But as they say, like not, most people are not doing online purchasing. So, what specifically we learn, I don't know. Or I should say, I don't know that what we're learning is universal, but it seems to be there's something there. And I find that interesting.
Yeah, no, it's true. I agree with you. I feel like what would have improved the realistic nature of the experiment obviously would have been if people could have taken their food home with them, or they actually could have ordered the food, right? And that would have been expensive for the investigators, obviously beyond what they provided here.
About $40 a person, I would say.
$40 per person, right? So if you have 4,000 or 5,000 participants in the study, obviously that adds up. But that I think would have been a more realistic experiment if you had said, then you actually take the food. So it might reflect more of what you might intend to prepare.
Yeah.
In your house. One of the other things I wanted to mention about this study is they seem to have recruited a sample of folks who were particularly well aware of climate change. And so which led me to believe, I think they said it was like 60%, I don't remember the exact number, of the participants who said they were either very or moderately concerned about climate change. And it led me to wonder if this was more of a selective group, their whole sample, including the control, but like if it was more of a selective group, and again, less reflective of the U.S. general population. And so if these labels were to roll out in a major way, should we expect to see less of an effect than we see here among a group of people who might have greater awareness about climate? Although they did have that finding showing that more highly educated people were totally unaffected, which I thought was kind of funny.
Can we talk about that? Yeah. So why do we think that is? I have thoughts, but do you all have thoughts on why?
Well, it seems like they looked for whether there were differences by education level, but they also looked by annual household income, which I understood why they did that, and we would absolutely hypothesize that would be relevant, and they did not find effects to be different by income. But it made me wonder if some of that education effect was related to income, correlated with income, because that makes a lot of sense in terms of if you have the resources, right, then you're going to be less sensitive to these price changes. That doesn't address the labeling question, but that seems a key piece. So I kept thinking about that correlation.
I think that's true. I think that's right. And I also think that maybe it was in there and I just missed it. But it seems to me the amount of red meat that you're consuming overall may be different depending, there's a distribution. And so if you're already consuming less red meat, you're already going to purchase less red meat, then these things, these taxes and warnings may have less of an impact. In the same way that, the warning label might have less of an impact if you're already very familiar with the risk and you've already, taken steps in your life to mitigate it, or maybe the opposite. You know it and you sort of like, okay, there's nothing I can do about it, so I'm not going to worry about it. And, so therefore it doesn't change my behavior. So I could think of reasons why. I just don't know that they get teased out here in a way that we could distinctively say.
My assumption in seeing that comment was that the more education that you have, kind of the more you think you know everything. That was that was like my take home. I was like, highly educated people, they're not going to, you're just like, you think you know everything. And so you're not going to be swayed by what someone else might be telling you in that circumstance.
Except for us. We do actually know. We do know everything.
But I kind of read it as like, I was like, obnoxious, highly educated people.
Yeah, no, definitely possible.
But you're right that they didn't kind of tease out exactly what that association or lack of association in that context could be due to.
There was another piece that's maybe related to this now that I think about it that I really wished had been teased out that just wasn't part of their design. And I was curious about this. So there was the dual label, right? They had two different messages, I think, on every package of meat. And I think in other labeling studies, often people test one message at a time. So they talk some about the idea of the sort of co-benefits of having an environmental message and a health-related message. But it's hard to read this as a public health person and not be curious about the distinctions between those, right? Because they're very different pathways to us thinking about how we change our behaviors. Am I being spoken to most by an environmental message or by a maybe more personal health message that's saying colon cancer, right? So, and plus the environmental message is very vague, right? The health message has the benefit of a little specificity, but they just say, what was it? Harms the environment.
Harms the environment. Warning is a big warning.
Very broad. So I was just yearning for, I guess, a follow-up, perhaps a design, or maybe they did this beforehand, but they didn't speak to it, in which they tested those two messages separately and together. I'm just thinking about these points you're raising about the education differences too, if there might be differences at that point when you were thinking about the different mechanisms that make us change our minds or our buying patterns.
I think that's totally correct. And a gap that I identified in reading this, although overall I really liked this study, additionally was they didn't focus on the potential implications of tax on meat for people who are food insecure or in a realistic setting for folks who didn't have a lot of money to spend at the supermarket. So I think that is kind of a practical constraint that steps in when you tax basic food products that they didn't really focus on here.
So my last question on this one is, and I understand why this would be hard to do, but is there any reason why this couldn't have actually been done in a real online store? So we know that online retailers do this kind of A/B testing all the time. You'd have to convince a retailer to be willing to do this, knowing full well that the goal is to get people to purchase less red meat, and they therefore may be against what they are, their interests, and so they might want to do it. But it's also like it's a small subset of the population, and they would at least learn something about it. There is then becomes the ethical issue of you then would have to do this without consent, right? But companies do that all the time. The issue is they don't publish their results, and therefore it's not research, and therefore they can get away with it. But I could imagine this would be the kind of thing that an IRB would allow a waiver of consent, because it's really just a marketing study in some way. I don't know that they would. I'm just saying I think that's possible. And so it seems to me theoretically you could do it in a much larger and representative of the population that's actually using online shopping, and you wouldn't have the same kind of biases, not biases isn't the right word, the same kind of influences on the effect sizes, because it was just what people were going to be doing anyway. I'm just curious your thoughts.
Yeah, I think one of the things that they did that allowed comparability was they set the shopping list, right? So everyone had the same shopping list. And in an experiment so you're suggesting where maybe people didn't know that they were part of an experiment, you'd have to somehow get comparable items on their list. Like in my household, we'll do like one big food shop a week, and then sometimes there's a secondary food shop where we're just picking up produce, or we just need small things, or a loaf of bread, or something smaller. And so that would be the challenge I could foresee in a scenario of trying to kind of have everyone go in without knowing, So what they could do here is they could set the shopping cart, which I think was valuable. Although I think you're right that there would be ways you could do this more realistically, even in an in-person supermarket. If the supermarket was amenable to, to identifying people coming in and saying, we're going to give you this certain budget, can you go buy these items? And then actually let them take them home at the end. You could also do it that way, in a non-online way.
I like that create a little supermarket shopping spree experience for people, because I think the other big challenge to doing this sort of in the real world is the point you're raising about sort of equity, people who are food insecure and who has the resources, and we're interested in that in the real world. But if we're doing this as research, we need to find a way to and especially if people are going to be randomized, stores or people are going to be randomized to different conditions, how do you make sure that everybody has the resources if they end up in the condition where there's tax being
Right.
applied, right? So I don't know what the design would be to make sure, but maybe it's give people a gift card at the start.
You could probably think, it could probably be some idea. Not that I think it's better than what they did, but like where you had a certain supermarket in a given community and you like on certain times during the day, you set a condition, but you'd have to compensate people on the back end, you're right, for the tax. Yeah.
Interesting. I really enjoyed reading this study, and I as I say, I get professionally jealous that they can do these kinds of things that we, much harder for us to do. But at the same time, it's great to read studies like this.
This is big fun points for this one. Yeah.
All right, so let's pivot to our second segment, and we're going to talk about an article that was published in the New England Journal of Medicine, a short piece called Countering the Health Disinformation Machine by Alex Carulian, who is the director of Fenway Institute's National LGBTQIA plus Health Education Center in Boston. And in it, the person is detailing their experiences. Well, since 2016, the Harvard Medical School has been offering this course that was entitled Caring for Patients with Diverse Sexual Orientations, Gender Identities, and Sex Development, a Clinical and Scholarly Elective. And this course had been going on for quite a long time, 6-7 years, before there's a lot of media attention now for LGBTQIA care, particularly around adolescence, and it's become something that right-wing media has paid a lot of attention to and critique of. And this got picked up by an outlet that engages college students to write for right-wing media, and they published a story called Harvard Med Class Focuses on LGBTQIA plus Infants and Older. And this, of course, got then picked up by all of the different right-wing media outlets. The director, who then explains that they then had to craft a response, which explained that in this case, infants only referred to the part of the course that was focused on sex development. So this was not a course around gender identity for infants. But of course, that is the way that right-wing media chose to interpret this. And this created serious problems for the institute in caring for a very diverse population, and a population that has historically had trouble seeking access to care. All of that is, once you then release the corrected information, it's too late, as we all know. We saw this during COVID regularly and repeatedly. Once bad information gets out there, it is all around the world. You publish a correction, even if it's published by the same people who were well-intentioned, they just got something wrong, and they publish a correction. Very few people actually read the correction, and this was a case where these folks were not interested in the correction, right? They were interested in a particular viewpoint and getting people outraged over something that had never happened. So obviously, no one really finds out about what is truly going on. This, of course, is, it's a specific issue that comes up that gets a lot of attention. But this is, as we say, this is COVID. We saw this regularly and repeatedly. And the title of the article is Countering the Health Disinformation Machine. So you can think specifically about this instance, or you could think just more broadly. Is there a way that we can actually be effective at countering disinformation? Or do we have to just expect that anybody who disagrees with what public health is going to do, and I'm focusing on public health, but this is, of course, true of any viewpoint, that there are going to be bad faith actors who are going to take things out of context and distort them, and no amount of care and attention to detail, and I'm not suggesting these people were not attentive to detail, but, is there any way to prevent this, or do we just have to expect this is going to happen and come up with strategies to counter it? So I'm just curious your thoughts.
Yeah. Well, first, I'll sort of just reflect on the sort of specifics of this piece, because in contrast to the conversation we were just having, which was about a fairly joyful article to read, this one was much more it's a very thoughtful piece, but also a very painful reflection on the way that our current social media environment in particular, but they point out in lockstep with conservative media outlets, has been so successful at fomenting, in this case, very specifically anti-LGBTQ sentiment and fear. Yep. So then even these really small, I would say small things like a single course at a single institution that's been willfully misinterpreted, then they escalate into this Category 5 hurricane, and including violent threats. Things escalate to violence, right? So it was a really nicely laid out case study, hard to read, but I just sort of wanted to, that's really the sort of first piece that I'm processing. And I, before we get to the prevention question, I think I can kind of enumerate some of the points that the author makes about the countering piece, because I do think in public health we need to really think about our strategies for countering as well as talking about the prevention side. The prevention side feels a little bit more unattainable. But I liked the way that they talked about sort of needing essentially like a constellation, right, of resources, and that we should be thinking as an institution strategically about how we have all those lined up. And perhaps here at the school we do, and I don't know how this works in other institutions. But so the things that he named: support from the leaders of the institution, in this case a hospital affiliate and an academic institution; support from funders, which I hadn't thought as much about, right?
Yeah.
Presumably not having to fear funding being pulled for the work that they're doing, right? Having a super savvy communications team who knew how to listen to the communities that were most impacted as they were devising the responses. Having journalists on board doing rigorous fact-checking, even though, as you pointed out, doesn't necessarily make a difference in the social media space, but having that in place was part of the constellation. And then he also talks about responsive law enforcement and social media platform policies for flagging and removing disinformation. So I think one thing we can talk about for prevention is how do we get the social media companies on board with coordinating.
Can we? I mean, in the current environment, can we get the social media companies on board? I would think that would have to be legislative, and that doesn't seem to be appetite for that at the moment.
Yes, but maybe at the state level.
Yep.
But I'm curious to hear your... Yeah.
No, it was such a tragic piece, and I really think for any of our listeners, if you have the chance to read this very brief article by a physician and a clinic director and an instructor who was affected by this misinformation campaign around his med school class, largely, which, as Matt was saying and Allegra was saying, was targeted for, trying to educate doctors about LGBTQ infants, which was it's like an absurd example, obviously, which is like clearly, you look at that and you're like, that's clearly not what they were doing. And so the kind of the obviousness of the willful misinterpretation was really clear up front. I mean, what stood out for me here was that for researchers, and in this case, teachers or clinicians who engage in these more controversial areas of research, there is such a barrier to entry if we look at needing to have your funders on board and institutional support and a strong media team behind you and journalists who you have existing relationships with, who can jump in and kind of provide backup for your work, that it really is a disincentive for folks to, from the professional kind of research, academic, clinical standpoint, to engage in certain whole areas of research. And that what was so sad about this particular, this is a needed, this is clinical training. This was a needed form of clinical education for doctors, and a gap in a lot of the current curricular offerings for medical students. And then it just provides all of these structural barriers for other institutions who maybe are not Harvard to be able to educate their, this is just doctors' education, but even doing research or educating other medical professionals, just the barriers to entry were just so stark and so alarming in kind of what he described were needed to engage without, being able to counter the misinformation.
Exactly.
Can I just go back to one thing you said, which is that this course was clearly not designed to deal with sexual identity for infants. And you said that's obviously absurd and wasn't what this was for. But the context here is a media environment that has convinced a whole lot of people that is the agenda, that is what these people want to do. And therefore, all you need is a name. Mm-hmm. You just go and find something that confirms your priors, and you can sell that to a lot of people very easily. And most people are not going to then look into what it actually means. They're just going to be outraged and look at what, the woke left is doing. So that was just one point. In sort of thinking about this, I think about, and I don't know how this would work, who would fund it, how, practicalities, but I think about, institutions that have heavy need for online security, so digital security, often hire people to hack them, right? We send people out to hack them, to try and hack themselves so that they can identify their own vulnerabilities. And there's a part of me that wonders, do we need the same kind of thing to say, go out and figure out how people are going to use anything that we do against us so that we know and are prepared and have developed a strategy in advance for trying to prevent and counter these things. I like that would probably have to be something that was done in the context of a think tank or academic work. But I do wonder about that. The other thing I do want to, I just want to counter just a little bit is to push back on a little bit of, not push back on, but to say this is a particular example of an issue that those on the left care about. The same kind of stuff does happen by those of us on the left in looking at the right as well. I don't think it's nearly as, in public health context, I don't think we see it as much. But I just want to point out, like, we are in a culture where people look to confirm their prior beliefs using social media rather than actually looking into the details. This one is just a particularly egregious one that comes from the right. And I do think that is, right-wing media is pretty famous for this. But I did just want to clarify that. But anyway, thoughts on this idea of building resilience through, trying to identify the vulnerabilities?
Yeah, that sounds spot on in terms of how we have to think from a sort of defensive stance, unfortunately, in this current era. And a defensive stance as we think about what it means to have conversations on social media, a space where we all can become very inflamed very rapidly without a lot of benefit, a lot of net benefit. So if we're thinking defensively, it does mean, I think that they talk in this piece about, removing personal information so as to not get doxxed. I think probably many people need to think about that, how your personal information is online. And there could be a system in place that an institution has to support faculty and staff, people doing research in all different potentially contentious corners to make sure that just at the individual level, the institution supporting individuals to stay protected.
Yeah, that's hard to do, though. It's very hard to get, once your information is online, it's very hard to get it offline. And it often, lots of things go online without your permission, right? People do things, put things out there about you when you're in a public, facing organization. So hard to do. Yeah.
But it does seem like the policy levers are also, even though maybe at the federal level this can't happen, there are state level mechanisms that we can think about in terms of trying to, and there are a few different, right? Meta's being sued right now by several states, not related to this, but we can think about what are our levers to get tech companies to be held more accountable to protecting users and making sure that disinformation can get at least addressed as soon as it's identified.
And I'm really curious where those state level approaches are going to go, or whether there's going to be, it's eventually going to make its way up to the Supreme Court that's going to say states can't make their own laws on things that go, that are not solely within their state, or they're going to say it's fine. I just have no idea. I'm really, really curious to see where that's going to go. Yeah. Any last thoughts on this one before we move on?
I had one last thought. Yeah. I feel like it puts a different spin on science communication.
Yes.
Also, and this is something that I think in the last decade, there's a growing awareness that among academic researchers, we also need to be trained in how to communicate the findings of our research, and that it's not just enough to get it into a great journal, but you have to think about what's the messaging, or else nothing changes because of the research that you do. But I think we don't have as much training on how to deal with what if your research findings are misinterpreted and then amplified, and then the misinterpretation is then amplified online. And so it's an interesting, maybe new component to thinking about, when you have a paper and it's getting published and you're working on the press release with the university, or they're trying to promote it, kind of what should you be aware of? What are the kind of concern or risk points? And then how might you counter those when you do your initial engagement?
I'm glad you raised that. I do work in LGBTQ health, and we have dialed back press efforts when when a paper's come out that we thought we wanted to share widely, and it's been at a time when there were amplifying violent threats. And I think we do need guidance in being strategic around that piece as well.
And it's very sad that, people exist in that professional space where you're doing important work, but there's personal risk, or there's a perception of risk, and it's scary.
Or even risk to other community members, right? Yeah.
All right, shall we move on to our last segment, which is our amazing and amusing? And I'll go first because I have a nice short one that I just thought was an interesting piece. So this was an article in Nature, came out on October 13. It was published by Juan Manuel Parilla, and it was entitled ChatGPT Use Shows That the Grant Application System is Broken. So this is clearly one for us here in academia. And it just, it's just a nice piece detailing his experiences with the challenges of writing grants, and it takes a lot of time, and you've been in situations where like you're almost to the end of being able to get a grant, but you're missing sort of those last pieces that are necessary, and so you miss the deadline and you got to wait another cycle, or it's just taking up so much of your time, and these are all things that talking with colleagues, he came to realize that some people use artificial intelligence, ChatGPT, and other, these other programs to help them with or to help them write pieces of. And, all that I can't say it surprised me too much to learn, but there was just one fact in here that I thought was interesting that I wanted to share, which is, so he was talking about his particular grant, used some, ChatGPT to help with some of the, some of the pieces that maybe aren't like central to the grant, but are more like the writing the abstract or institutional resources, that kind of stuff. They got the grant in on time. He said, next day, while speaking to a friend, I told him, this week I wrote my first ChatGPT grant. He replied that he'd been doing it for months and that many other scientists are doing the same. A 2023 Nature survey of 1,600 researchers found that more than 25% use AI to help them write manuscripts, and more than 50% use them to help with grant proposals. I have never done this.
we are behind the times.
I guess I would feel like I was somehow cheating, and therefore I wouldn't use it, but maybe I should be using it. I don't know. I know that, some journals have now come out with statements that ChatGPT cannot be a co-author. ChatGPT, I guess they say you can use it, but you have to disclose that you've used it. I'm just unclear what the right thing and the wrong thing to do is when it comes to things like grant writing and manuscript writing. Can we use it? Can we not use it? Should we use it? Should we not use it? I'm baffled to find that almost a quarter of people have been using it for manuscripts. I've never used it once for anything other than to ask it stupid questions.
People also use it to generate tests and problem sets and academic materials.
Yeah, I'm okay with that.
Yeah.
Right? I mean, that certainly doesn't get to, there's nothing about a test that says it has to be original, right? I could find something off that somebody published on the web and I could give that as a test. I don't think that's a problem. The question is, if I'm passing something off as original content, is it okay? I mean, I kind of think it is, as long as I'm not just having it make up the results, as long as I'm having to as long as everything is truthful. But I don't know.
But there's a big gap there, because I think, I have definitely played around with ChatGPT in this context. I've never used it, but I've played around with it, and I don't find the writing that great. So that's right. And so I'm this doesn't sound like something I would say, and I don't feel like the quality of the writing is as good as what I would want to use.
So I have two thoughts on that. Yeah. One is that I think, he did say in here that, in some places you have to punch up the writing, but he actually said in some cases the writing was better than what he would produce. And the second thing is, even if it is not great, I think that's a short-term problem. It will get better. Yeah. And so, I don't know.
I think the other thing we have to talk about is ChatGPT learned from your past work, right, and others' past work. So it is borrowing sometimes, whole cloth ideas from others. We don't necessarily always know.
Yeah.
And that was all, that's all uncompensated intellectual and other labor that folks have been doing that, OpenAI and these other companies get to make a killing off of this. I think it makes me very nervous, and I'm glad you raised it, and we should keep talking about it.
And there also are, things that are just factually incorrect that you have to obviously be careful about with ChatGPT.
Fake citations.
For studies that don't exist. I've encountered this. Right, and it's these are not actual studies, and then you're like, oh no.
Oh, you are responsible for that,
right. So it's buyer beware if you're going to use that. You have some big gaps still, but I'm sure you're correct though that they are temporary. Some of these gaps are temporary.
Yeah. All right, Allegra, what have you got?
Well, I learned this.
I know what you have.
Did you see this in the Washington Post?
I did, and I think this is awesome.
I know we're 2 days after Halloween, and who knows what, I don't know when this airs, but I'm still in the Halloween spirit. And this is actually from a paper published in Frontiers in Psychology back in February, but picked up by the Washington Post this week, I think in honor of Halloween, investigating the etiology of the fear of clowns, which I have now learned is called coulrophobia or colrophobia.
Can you disclose, do you have fear of clowns?
I don't, which is probably why it was easy for me to dive into this paper.
Do you remember we did an episode on this about the clowns?
On this paper?
No, but about fear of clowns.
In general, so it has come up multiple times.
Yeah.
This is apparently a thing. We were not aware of it either. Right.
I remember having a friend who had a severe fear of clowns, and I witnessed it once, and I realized that it's severe.
It is
very scary.
You can see why. I mean, I didn't have fear of clowns, but I could see why. They are... It's a weird thing, especially that you want to like show to kids, like have kids. I don't know.
It's like a variation of like a monster, or like in some kind of strange human form.
Strange human. That's one of the etiologic pathways they talk about, the uncanny valley effect. So they did make a strong case that this is a very under-researched phobia. It's not actually in the DSM-5, sort of so it doesn't have that stamp of validation, but it's a very common phobia, they say, based on some very non-rigorous epidemiologic research. But so we don't really know the prevalence. Prevalence is across multiple cross-sectional studies that were non-probability samples seem to vary from 2% to 50%, depending on
how the question or the clown that they were presented with,
yes.
the experimental condition.
Yes, I'm sure.
Is this Stephen King clown?
That came up multiple times. Ronald McDonald comes up as a classic example of a clown that many people find.
I'm with you. Ronald McDonald is a little creepy. For kids, anyway.
So for me, I mean, I think the take home here is that I'm always interested in folks who are exploring areas of our sort of thought process, our very culturally specific, but also cross-cultural kind of fears and interests. And they've done that. They've made the case that this is worth thinking about because it is more common than we realize, but we don't really understand. And it also allowed me to learn that there's a whole field of study of folks who are interested in what defines creepiness itself. And that itself is
We're in the wrong field.
Interesting.
Wow.
So if we want to do a deep dive, there are psychologists thinking about how we define creepiness and also whether why we're afraid of clowns, which this, short story is, in this sample, it did not seem to be based on negative experiences with clowns. It was these other pieces, the uncanny valley. They're not quite human. They're hiding their emotions and there are a lot of negative media portrayals. So, but it isn't that we've been harmed by clowns typically.
I hope not. I'm pretty sure I said this the last time we talked about clowns, but I had two friends, one from high school, one from college, who both independently met each other at clown college.
Oh, yes.
So I have two friends who went to clown college, and I don't know what that says about me, but I bet clowns are apparently a thing.
They are, and I bet they'd take issue with this characterization because clowns actually cover a broad range of performance. So I just want to honor that clowns
The article we had reviewed a couple of years ago was not exactly about fear of clowns, but it was about the use of clowns in pediatric ERs and pediatric hospital procedures to try to ease the anxiety of children, which led us to a conversation of maybe it would have the opposite effect.
There is some research on that. Right? Some subset of children and their caregivers are not fans of that, but others find it very helpful.
Wow. Well, that's crazy and hard to beat. But my final, this was also from Nature, just from this past month. And this is the kind of article where I personally love to peruse Nature because it's so different than anything I ever think about. So have you ever wondered where the head of a starfish is?
Oh, I have.
Have you?
I wondered where the
sea star. They actually call it technically a sea star. The head or the
like where is the mouth?
Apparently, this is one of the largest zoological mysteries.
But we know this because there's a starfish on SpongeBob, and he has a face.
Oh, that's right in the middle.
Yeah, it's right in the middle.
Obviously, we should comment to Nature with that.
It is right back.
Right. Apparently, the location of the head of the sea star is one of the enduring zoological mysteries of our age, as is the growth patterns of the sea star, because apparently in a larval form, they are bipedal.
What?
And then as they grow their 5-leg design that we are familiar with. And so the question was from an evolutionary perspective. First of all, why and how does that happen? These are a form of animal called echinoderms, kind of like sea urchins. Like, why do they develop in a way that's very parallel to many organisms at the beginning, but then they diverge into such a crazy way where they don't even seem to have a head? And so this is a paper published in Nature. This was a group of researchers at Stanford. What they did is they used RNA sequencing to be able to identify different cells associated with different body systems. They sampled from across the sea star, and they were able to identify cells that had the structure of or function of head cells, I guess.
What are head cells?
I don't know.
Like brain?
Brain cells or cells that would have gone into like a neurological structure.
Yeah. Okay.
And they found them diffused among the arms and limbs of the sea star. And they generated, I just printed them out, these beautiful kind of 3D figures showing kind of the sequencing of the different functions of these cells across the different parts of the sea star. And this was just research to me that was so different than anything I ever would have done, but basically found that the sea star has diffused. They said it had no one core head, unlike, who was that character on SpongeBob?
I don't remember. I don't watch enough SpongeBob
the star,
to know.
Unlike a head and a face, but it's kind of diffused among the animal, which I thought was kind of intriguing.
That is good to know. That's going to change my view of star. What are we calling them?
I think when I was a kid, they were called starfish.
Yeah, I thought
but then
they were
I think
starfish.
they renamed them sea stars because they said they're not fish.
Oh, okay. Well, it's going to change my view of sea stars forever.
Forever. That's what I'm going for.
Okay. So when I talk to it, where do I look?
You just got to keep the whole thing in your
just
frame.
constantly being okay. Got it.
Right.
Okay. Well, that is the end of our program. If you got any feedback on this or any other episode, or you want to suggest a study or a topic for us to take on, you can leave us a comment on the Population Health Exchange website at pophealthex.org. We want to thank Nick Guler at BU School of Public Health for sound and producing. Normally, but today Mark Takakti is filling in and doing the sound and production. Thanks for joining us. We hope you enjoyed it, and we hope you will download our next episode.